Welcome to our Learning and Sharing Cafe today. We're very happy to see everyone joining us today from all over the world. First, let me introduce myself. Andy Kendall, I'm the Tech RT Program Director, and we are happy to be today at our Learning and Sharing Cafe, a relaxed place where we can all learn and hear about other people's experiences and see how we can contribute as well. I want to thank everyone for joining us today. I see we have different participants from lots of different parts of the world, just to name from Bolivia, from Kenya, from Jordan, from Canada, India, Lebanon, just to name a few. So I want to say good morning, good afternoon, good evening to all, and we're happy to have you here today. So as you may see, we are recording this Learning and Sharing Cafe so that others who aren't able to join us today are able to listen in, to hear everything and share and to learn from the experiences that we talk about today. The slides and the recording will all be available on the website, on the TechRT website after the webinar. It will also be sent out to all the participants, so don't worry too much about that, and you know that that's taken care of. While we're getting started, if I can ask you to all introduce yourselves in the chat box, that will also give you a chance to get acquainted with the controls that we have. There's a chat box where you introduce your name, your organization, if you have one, and what country you're calling into us today from. There's also a little button that says Q&A on it. This one is for asking questions, so that when we get to the question and answer session towards the end of our Sharing and Learning Cafe, we'll be able to have those questions on hand easily to be able to be answered. When people are writing questions in there, if you have the same question as that you've seen somebody else have, you can upvote it by putting a thumbs up there, and that will increase it to jump it up the queue to be answered. So please do go ahead and play around a little bit with that. Look for your chat box, look for your Q&A. So today's Learning and Sharing Cafe, it's about IYCF programming adaptations in the context of COVID-19. This is the second Learning and Sharing Cafe, and we do hope to have some more coming in October. The cafe today, we have lots of different organizations involved to bring it to working behind the scenes to bring this to you here today. So the Tech RT is organizing and hosting the webinar. The GTAM has been highly involved. GTAM is the Global Technical Assistance Mechanism for Nutrition. It's a common global mechanism endorsed by over 40 GNC partners, Global Nutrition Cluster partners, to provide a systematic, predictable, timely, and coordinated nutrition technical assistance in order to meet the nutrition rights and needs of people affected by emergencies. And the GTAM provides webinars like this one. The GTAM has global thematic working groups. The IYCF, the Infant Feeding and Emergencies Core Group is actually the chair of the IYCF Global Thematic Working Group for the GTAM. This webinar has been put together by lots of different organizations, the IFE Core Group being very core in that, as well as the World Food Programme and UNICEF and Save the Children really spearheading the whole series. We have different organizations that have worked a lot on today's webinar, including UNICEF, Concern Worldwide, Save the Children, as well as USAID, Advancing Nutrition. They are some of the presenters that you will see today. So I want to welcome you to our Learning and Sharing Cafe. And I also want to mention that we do have simultaneous interpretation for the webinar today. So as I mentioned before, if you go down to the interpretation button, you can select French or Spanish or English to choose what language you would like. So as you see on the screen now, you'll see the donors that support Security, which helps to bring these webinars to you. The webinar is made possible by the generous supports of these donors. However, the contents are not the responsibility of them and do not necessarily reflect their views, just so you know. Okay, on to the next slide, please. Okay, the objective of today's webinar, so that everyone is clear, we're just trying to create a platform where countries can share their lessons learned and the experiences in adapting IYCF programs in the context of COVID. We know the situation has been strange. It's coming on some months now, I think up to 5 months now, but it still is difficult to figure out what is the best way to adapt our programming to make sure that we are continuing to protect, promote, and support breastfeeding and infant feeding. And it's not so easy to do in the context of COVID when you're not really clear. You don't want to put anybody at risk. And this is what our Learning and Sharing Cafe is all about, to help you to do it in a way that doesn't mean stopping your programs. The second objective is to reflect on how global guidance have helped and have been used in inspiring and guiding these adaptations. We also want to encourage others to submit ideas for the next World Café that we hope to put on in October this year. On to the next slide, please. So today's webinar, we have the plan for the day is, as we've just done, is gone through the objectives, and we're about to go into the introductions. Then we will go into a fantastic presentation that I think will be super useful for all of you today, which is on how to communicate infant and young child feeding recommendations in the context of COVID-19. Lots of different resources available for you there. Then we'll go on to 2 case studies that talk about the IYCF adaptations that have gone into programs in Somalia by Concern Worldwide, and then in Uganda by Save the Children. So we'll get to see how they have adapted their programming to the current context. That will be followed by a questions and answers session. So please do not feel shy. Please do write your questions and comments and input into the Q&A box to be handled during that session. That will be followed by interactive gaming quiz. And then we would like to invite you to today's evaluation is special because we are wanting you to evaluate the Learning and Sharing Cafe, but also we need some input from you on how you are adapting your programming. Have an added part to that. And then finally will be the evaluation and the wrapping up. Great. Okay, on to the next slide, please. Next slide, please. Great. Okay. So we're going into presentations of all the presenters. I will start first. I already mentioned myself. I'm Andy Kendall. I'm the program director for the Technical Rapid Response Team, also known as TECT. And before I hand over to Alessandro, I would like to introduce a couple of people behind the scenes. We have Rita Abi Akar. She has been instrumental in getting everything off the ground, the organizational side of the webinar. We've got Geraldine Belloc, who's on the chat box today and is helping support as well as we have 4 different interpreters who are on the line today. And my apologies, I don't know exactly who we have today. I would love to introduce them by name. Apologies to you. But we thank them very much because it makes it possible for us to have lots of people on webinar today in different languages. Okay, with that, I'm going to hand over to Alessandro to continue with the presentations. Thank you. Over to you, Alex.
Thank you, Andy, and thank you, everybody. Yeah, my name is Alex, so Alessandro. I'm the Global Advisor for Infant and Young Child Feeding in Emergencies for Save the Children. Just few additional words. It's really, once again, is an opportunity that the IFE Core Group and the Technical Rapid Response Team and the GTAM, the collective, basically, our community of practice is providing to some organizations and country offices in sharing the great work that they are supporting and implementing, despite, of course, the challenges. So my message is more to encourage everybody else, any other organization, any other country, to contact us, to reach out if you have any experience that you would like to share. So here we have we have Linda from the IFE Core Group and myself that are more than willing to get in touch with you and see if there are even more experiences to share. No? So please take it as an encouragement and a motivation to share your experiences so that we can enrich our community of practice and engage it as a whole. No? We are all working under the same roof and with the same intentions and objectives. So without further ado, I would like to ask the presenters to introduce themselves very briefly, starting from our colleague from UNICEF. Over.
Hello, everyone. This is Ashima Garg. I work with UNICEF New York headquarters as nutrition specialist, focusing on young children's diets.
And hi, this is Peggy Konis-Boer. I'm a senior advisor working with USAID Advancing Nutrition. I am a nutritionist focused on behavior change and supporting infant and young child feeding, adolescent nutrition, and early childhood development. I've worked extensively in Latin America, Africa, and South Asia.
Thanks, Peggy. Our colleagues from Concern Worldwide, Somalia.
Hi all, my name is Sarah Ahmed, and I'm Infant and Young Child Feeding Officer at Concern Somali Program in Mogadishu.
Thanks, Sarah. Next. Emmanuel.
Thanks, Alex. This is Emmanuel Baraza, Health and Nutrition Program Coordinator, Concern Somalia. Thank you and welcome.
Colleagues from Uganda, thanks to us.
Hello, everyone. I am Lona Muhirwe. I'm the head of health and nutrition with Save the Children in Uganda.
And the last but not the least, the facilitator for the question and answers, our colleague from WFP.
Hi, everyone. My name's Deborah from WFP Rome headquarters, maternal infant young child nutrition specialist and inclusive nutrition team lead. Greetings.
Thanks. Andy, back to you for the kickoff of the presentations. Thanks, everyone.
Wonderful. Thank you, everyone. Okay, I'm not putting my video on because my connection doesn't seem to be great today. Okay, on to our first session. It's how to communicate infant and young child feeding recommendations in the context of COVID-19. And Ashma and Peggy will give us this presentation today. And again, please be sure you've got two different boxes at the bottom. We've got the Q&A where the questions go, and we've got the chat box. One mention for the chat box. If you want everyone to see your message, it needs to go to all panelists and attendees, not just all panelists, okay? Okay, and now over to you, Ashma and Peggy. Thank you.
Thank you, Andy. And hello, everyone. And this presentation picks up from where we left in the last cafe. So I just hope some of you were able to attend our last cafe on 30th of July, where we talked about the programmatic adaptations required in the context of COVID-19 to implement programs on infant and young child feeding. In this presentation, Peggy and I will zoom into how do we communicate. So building on the challenges which were talked about in the last presentation, last session, we will focus into some of the resources and tools which are available to help us communicate better. I will start the presentation with sharing with you some of the global and regional resources available. And then Peggy will do the exciting part of the presentation, which is zooming into a very, very rich resource. So to start, first slide is around reminding us that we do have global guidance on infant and young child feeding in the context of COVID-19, which was developed quite early on during the pandemic. Around March, we had the guidance from WHO and UNICEF on implementing or recommendations around IYCF in the context of COVID-19. These guidances have also been updated with time, and the one which you see on the screen, and for everything which I'm going to share, I have included the links so that once the presentation is shared, in case some of you have not seen these resources, you can access these online. So for WHO, they updated their guidance in May, and we have the updated clinical management of COVID-19 guidance available. And there was a programmatic brief which was developed by UNICEF, Global Nutrition Cluster, and GTAM and partners, which is available in multiple languages, which talks about how these global recommendations can be translated into programmatic implementation, talking about the key considerations which can be taken and giving some leads. And one of the key takeaways which we want to start with is, first is that these global recommendations reinforce and confirm that in the context of COVID, IYCF practices of breastfeeding and complementary feeding need to be continued by practicing recommended hygiene precautions, or we call as infection prevention and control measures as outlined in WHO guidance. Next. So one of the key recommendations, zooming into the programmatic side, which the programmatic brief makes, is making sure that these global recommendations are implemented or translated into simple, practical, and context-specific information. And it is available through multiple channels, communication channels. So this was the main recommendation which was there as part of the programmatic brief, which we made, that all this global recommendation need to be translated and communicated in a simple, practical manner using different communication channels. Next. And which brought us to think about the question that how can these global recommendations be communicated? We were dealing with a situation where we do have IYCF programs in place. The recommendations, we know what needs to be done for breastfeeding, for complementary feeding, but the issue was, how can we adapt our existing communication tools, resources, using some existing or new practical channels? And that's when the global nutrition community, as well as the regions and in the countries, we all started thinking way back in March. And since March and now, a lot of resources have been developed with the collective effort of so many organizations, individuals, governments. So there are so many stakeholders which are involved. And what we thought may be useful is, before we go into the second half of this cafe on the country experiences, to share with you some of the resources which have been developed at the global level, but also at the regional level to trigger some thinking around it. Next. A lot of questions and challenges we have faced when we talk about IYCF. Previous slide, please. Has been in the context of communicating breastfeeding in the context of COVID. We talked about some of the challenges in last webinar, and here I'm highlighting some of the very good resources developed by WHO, UNICEF, and Global Breastfeeding Collective, which you see on this slide, where we have some very good frequently asked questions and Q&As available, both for health workers, but also for mothers and caregivers. The questions, if you haven't just looked at these, please have a look at these resources, because a lot of effort has gone in trying to pick those questions which were coming from the field. Like the first one where it talks about, these are the questions which are generally asked by families to the health workers and supporting health workers in answering those questions. It also talks about presents a decision tree to help the health worker decide how the action should be taken and how the information to be given to the mother suspected or confirmed with COVID-19. We also have some very nice infographics available, developed by WHO, which you see on these purple, they call it tiles, but these are infographics, which can be used using different platforms like digital platforms, or just integrated and communicated in the way social media, you can use it, and it communicates the key recommendations from WHO. We also have some very relevant advocacy messages for different target groups or influencers, as I may call them, on breastfeeding and COVID-19, developed by the Global Breastfeeding Collective. And it helps us give some direction on how we can communicate better and with whom we should be communicating around issues or challenges being faced in breastfeeding in the context of COVID. Next, please. We also have some available videos. I think a lot of us may have seen it, but the first one, I really love it, and I'm sure everyone loves it, whosoever has seen is a great video on COVID-19 and breastfeeding developed by WHO, UNICEF, and PMNCH, and which is available in multiple languages: English, French, Spanish, Russian, and Chinese. It's an animated video which fits in multiple contexts and also communicates the essence of what the key message around, and also highlighting some of the fears and dispelling those fears and answering those in the context of COVID for breastfeeding. We also have some videos available on complementary feeding, which is the first food videos for frontline workers and caregivers, which were developed by UNICEF and Global Health Media. This is not COVID specific, but it is a series of videos which can be used and adapted to different platforms. For example, in Eastern and Southern Africa, they are trying to integrate some of these videos into the digital platform, or sometimes these videos are being integrated into e-learning platforms. And that's why they reinforce the how part, especially in the context of the current lockdown situation, access issues. The question which mothers and caregivers are facing is how can they feed their children nutritious diets in the context of limited availability? How can they take care of their children? And these videos can be very helpful resource. And they are available also in multiple languages: English, French, Spanish, Swahili, Nepali, Hausa, and Yoruba, because also these videos have been shot in 3 different countries. So it has a combination of Asia and Africa images. We also have some additional videos, both COVID specific and not so specific. It's from the Asia region, where we have, I mean, I've only put the snapshots, but you can see the videos in these, using these links. We have a specific video on advice from the South Asia region, which talks about breastfeeding during COVID, and another video from East Asia and Pacific region, which talks about or recommends an animated video on complementary feeding. So these videos can be integrated using different platforms and can be very helpful in the way you see integration into your existing resources. Next. And then one of the mediums which we all will agree wherever it works in the countries is through social media platforms. And some of the efforts, while the messages still remain the same, we just need to repackage the existing key messages around these recommendations into a more friendly way so that they can be integrated better into the social media. And some of the efforts, I will say it's a great effort which has been done by UNICEF's Regional Office for South Asia. And they have developed this IYCF and COVID-19 social media pack, the link is there, and it provides like little tweets and key messages which you can just use to reinforce. It has infographics, it has some very compelling, clear messages which are available, which can be picked up by different countries as per the context or adapted for their context. So this is a great resource, I feel, which is available. Our East Asia and Pacific office has also tried something innovative, because that's one region where the social media is used extensively, and they have tried to have blogs and key messages on their websites. It's available on UNICEF website, but can be used further. And I have included the links where things answering questions like what will children be eating in the post-COVID world. It's like triggering your thinking, but at the same time also having some advice on feeding young children during COVID-19 pandemic. So these are some of the resources I feel we all can adapt and use as per the challenges we identify and the programmatic implementation. Next slide. So this is the exciting part of the presentation, as I said to you. And in addition to all these different resources, one of our major resource for which a lot of people have worked very closely, and my colleague will talk more, is the counseling package in the context of COVID-19. This counseling package was a very collaborative effort done by UNICEF, USAID Advancing Nutrition, with the support of IFE Core Group, which was represented by Save the Children and Safely Fed Canada. The whole logic of why we thought that this resource was important was triggered by our question that we did not want to create resources which were new, which were unfamiliar, which would have taken longer to be integrated into government systems. So we thought about what are the existing IYCF tools which are, if we develop something at the global level, will be easily integrated into the existing systems. And that's when we thought about the counseling package, because it is one of the tools which has been widely integrated into existing delivery systems, into existing counseling. And that's how we came up with the idea of taking this forward. And with that, I'm going to hand it over to my colleague, Peggy, who will take you through the details of this package, and let's hear from her the exciting part. Peggy, over to you.
Okay, great. Thank you, Ashima, and everybody for this opportunity. This package is a set of 10 counseling cards and a booklet that is focused on recommended practices for infant and young child feeding in the context of COVID-19. The package translates global recommendations into user-friendly illustrations and messages for both counselors and low literacy communities in different contexts. These materials may be periodically updated to reflect new and emerging evidence. During the development of this generic package, it was field tested across multiple regions of the world with the idea that it could potentially be used as is in many settings, but could also be adapted graphically for other contexts. In the next few minutes, I'd like to very quickly share the English version of the 10 counseling cards and the related pages from the booklet, and then to share some other resources that we've put together for you. Next. The first card is on actions needed to prevent the spread of COVID-19. Next. And then the second card is on how to take precautions during delivery and rooming in. The third is on taking precautions when breastfeeding day and night. The next is on hand washing with soap to prevent the spread of COVID-19. And then the importance of washing hands for at least 20 seconds following these specific steps. The next card is on practicing food safety and preparing clean water. And then we've included a card and key recommendations around practicing safe complementary feeding. then when to seek advice from the health facility, trying to encourage the continued use of health facility. The next card is on how to hand express breast milk and to cup feed infants. And then the last card could be used if mothers or family members give infant formula while recovering from the virus. And it's on how to safely mix and feed the infant formula. Next. So all of these materials can be found on the USAID Advancing Nutrition website by following the link provided in the slide above and then later on and hopefully in the chat. Next. As you scroll down the web page, you will find links to the large and small PDF versions of the complete set of counseling cards, an editable Word version of the recommended practices booklet so that you can edit it according to your national guidance, and small PDFs and JPEG versions of each of the individual cards for easy sharing on social media platforms. Our aim in making this package available in all of these formats is to help ensure that communities and families around the world have access to these recommendations to help prevent the spread of the virus and to care for those who are infected. On this page of the website, you will also find multiple translations of the package, which have been developed over the last months by colleagues around the world and shared in the spirit of encouraging and facilitating additional regional and country level adaptations. So although the graphics have not been adapted in every region for every country, the text has been. So a very, very special thanks goes out to UNICEF West and Central Africa Region Office, the UNICEF Latin American and Caribbean Regional Office, and the UNICEF Mozambique Office for the French, Spanish, and Portuguese versions, and then the UNICEF Syria Country Office for supporting the Syrian Arabic translation. We'd also like to thank our USAID Advancing Nutrition colleagues in Kyrgyz Republic for supporting the Russian and Kyrgyz translations that can be found. On the site, you will also find a simple adaptation guide with step-by-step instructions and a field test instrument that can be used after you've developed your drafts to test the materials in your setting. Next.
Peggy, you've got 2 more minutes, okay?
Okay, the complete set of Adobe InDesign source files for the generic package are also found on the website by just clicking that red button. You'll also find a link to the Infant and Young Child Feeding Image Bank, which was created several years ago, a collaboration between Spring and UNICEF. Next. And in that image bank, you'll find over 700 images from the UNICEF Community IYCF counseling package and others that have been adapted for various countries. The IYCF Image Bank is a repository for high quality illustrations that can be adapted in Photoshop or other graphic editing software, and they are open access. Okay, next. Next. And finally, I just wanted to share a few of the adaptations of the IYCF and COVID package that have been shared with us, including Afghanistan, Indonesia, India, and Syria. And we will continue to add examples from other countries as you share them with us. And so in closing, please check out the resources on the USAID Advancing Nutrition website. Again, this is a collaboration between USAID, UNICEF, and the Infant Feeding and Emergencies Core Group. Please share your ideas and questions in the chat and share links to other resources. Feel free to email us if you have any questions using that info@advancingnutrition.org. And next, thank you very much for listening.
Thank you so much, Peggy and Ashima. That was super, really, for me. This presentation brings to life all of the links that we often get really showing us what the resources are that we have available to us that are super user-friendly and can be adapted to every context very easily. So we really appreciate that presentation. Now, could we go on to the next slide, please? Okay, we're going to hand over now to our colleagues at Concern, to Emmanuel Barasa and to Sarah Ahmed, who are going to tell us about their experiences in the context of COVID. Thank you. Over to you, Emmanuel and Sarah.
Thank you, Andy, and welcome all to this cafe. Concern, we're going to just talk about a case study of few adaptations in relation to IYCF in Somalia. As most of us know, Somalia is the second most fragile country in the world. And with the COVID-19 situation now, complicates what we call the triple threat of the associated floods and also the desert locust situation. 5.2 million people are projected to be in need, and with around 1 million children projected to be malnourished. Next slide, please. Okay, just a brief of some background information. We see the IYCF practices very, very low in Somalia. Explosive breastfeeding, minimum dietary diversity, and minimum acceptable diet at 33%, 15%, and 9% respectively. Very, very low practices in country. Next slide, please. Now, some of just the pre-COVID and IYCF programming that used to happen. We have these at the facility level, at the community, and the general activities. So at the facility level, we usually conduct IYCF counseling sessions, and these are done every day, each and every day, at whatever time that the client comes. Then we have 2 promotion sessions. One is the group promotion session that targets mothers who come for OTP, and these are done every morning on OTP days. And then the mother support group sessions, this is a schedule over a 2-month period that is conducted once a week. Next slide, please. At the community level, we do household counseling visits for selected households. Our focus for selection mainly is those mothers who have defaulters and those that are non-recoveries that we focus on, so to be able to identify what might be the reasons and provide the support, and also the mother to further support group sessions. Just to note that in the context for Somalia, these are done separately. And general IYCF activities include capacity building for CFWs and the health workers on IYCF, assessments and surveys, for example, CAP surveys, and activities related to protection and promotion and support for breastfeeding, and IYCF preparedness. Next slide, please. Okay, what are some of the challenges that are brought about by COVID-19? So this would be an exciting part where we have the challenges and the related programming adaptations to be able to address those challenges. So the first challenges are associated to fear, stigma, and misconception. One is fear of contracting COVID-19 from the health facility and healthcare workers. Most of our beneficiaries had this fear, especially at the onset of COVID in Somalia. There are a lot of myths and misconceptions around COVID-19 and breastfeeding, whereby some caregivers are not very, very comfortable to follow adaptations to, for example, to put on a mask while breastfeeding your child. And the other one include denial on the existence of COVID-19. Most people still in Somalia have this denial. Some still say that COVID-19 can't infect Black people, you know, and such like related denials, and also there's a lot of stigma associated with wearing of face masks. For example, our IYCF facilitators, at first, it was a very, very huge challenge to go wearing a mask. They'll feel like you have maybe COVID and that's why, or you suspect that they are infected and you're protecting yourself. So some of the adaptations that we put in place to address fear, stigma, and misconception include triage at the health facility. We have introduced extra triage areas to be able to create some confidence to the beneficiaries that we are taking precautions. Thanks to IYCF key messages from WHO, UNICEF, we've had to translate some of that to local language for easy understanding and to curb the misconceptions, including the IEC materials that we've put in place both in community centers and in our facilities for easier access, and most of these are visual. We have had to conduct some training, a lot of trainings on IYCF in the context of COVID-19 to our staff so that they are well equipped to be able to provide this very, very important activity. And also COVID-19 messaging has been incorporated in all IYCF messaging curriculum. Next slide, please. Okay, challenges related to continuity of services. We've had a challenge to adjust modalities to ensure IPC measures and also space challenges in our facilities. And the adaptations to address this, we've had to reduce the number of participants for the group meetings and to cover up for those participants, we've had to increase the frequency of promotion sessions. Sometimes we used to do only 3 in a week, and now with COVID, we are forced to do at least 7 to be able to cope with the number. There has been a challenge related to hand washing. It's a big challenge in most of countries in the sub-Saharan and the Horn of Africa. And now with COVID-19, it gets even worse. And we've had to make it mandatory for hand washing, put in place at various entry and exit points. And we've had role models that demonstrate this to the caregivers, and also that ensures that every beneficiary adheres to this. And some of these have been community role models or champions that propagate this to the communities where they come from as well. And we've seen a very, very good improvement, as we'll see later. Other challenges, of course, the workload to staff, as I mentioned about increased sessions, increased costs for procurement of PPEs, and the information overload, a lot of information being shared on COVID-19, plus the general behavior change messages. And for this, we continue to do mentorship and support for our staffs. Huge thanks to some of our donors. Most of them have been very, very flexible. Just to mention, for example, the BRICS DFID funded program was very flexible and introduced an RRF grant. This enabled us to have additional staff and also the cost for PPEs. WFP, UNICEF, WFP was very, very active in adapting modalities and sharing the adaptations. And thanks to UNICEF also, apart from the messaging, they were able to also provide some additional fund to some of the grants in Somalia, short-term emergency 3-month grants to enhance COVID-19 awareness, extra staffing, and most importantly, PPEs. And we do prioritize key messages during sessions just to ensure that most of this information overload does not interfere with the intended objective. Next slide, please. Good. What are some of the enablers that have enabled us to adapt our programming? Concern is actively involved in clusters and coordinating with the MOH and various working groups. Is a member of the Nutrition Somalia Strategic Advisory Group and the IYCF working group. Good context knowledge of the team. Good acceptance. Concern has worked in Somalia for a very, very long time. Dedicated staff. And as I mentioned, donor flexibility. And we can't fail to mention our dedicated HQ staff who liaises with the global platforms. For example, this session, we got it through effort from our HQ support and the emergency preparedness team, plus the surge team. Next slide, please. Okay, a few pictures here just to give a visual projection of what happened before and now. With the COVID, you'll see the IYCF counseling before and after, with the 1.5 meter physical distancing plus the mask PPEs. The group sessions, you'll see previously people were crowded together and now spread out and also with PPEs. Same with the training aspects. You'll see after that people are spaced out with the PPEs, and the before you see people together. So all these activities are still continuing even with COVID-19, but now with adaptations. Next slide, please. What are some of the lessons that we've learned from these adaptations? Of course, behavior change takes time. So mutual support and continuous messaging has proved to be a key factor in addressing stigma. And we can borrow not only for IYCF, for COVID, but even for IYCF. Hand washing, we have realized a great, immense experience with this. For example, when we compare our diarrhea caseload pre-COVID and within COVID, we see that the diarrhea situation caseload has really gone down. This demonstrates partly, I think, to benefits of proper hand washing. Community champions or role models at the hand washing facilities have been very, very effective, and to also provide that needed change and in the society. So we see that this is a great aspect that we can employ across our various community programmings, and also the importance of complementary community-based activities and household visits to supplement facility-based interventions. Next slide, please. Communication tools. Sarah, here I hand over to my colleague Sahara just to finalize this. Sahara, please.
Thank you, Emmanuel. Here, the communication tools we use are general awareness and specifically COVID-19 related communication tools. One of them is the counseling cards and key messages booklet, and also the usual curriculum guidelines for mother and father support groups as well, and the tools for reporting and capturing the data for the registers. So as you can see, the next slide, please. Next one. These are the clear photos that the counseling cards and the key messages booklet pre-COVID and after COVID. So the above ones are mainly talking about the guidelines and the tools we use for our IYCF counseling session when it comes to the COVID, and the lower ones have been the usual one. So those are the main communication tools we use for our IYCF counseling sessions. So thank you very much, and over.
Wonderful. Thank you so much, Emmanuel and Isaira, and Concern, for sharing the experience that you've had in Somalia. It's great to see how, in fact, the adaptations and programming for IYCF in the context of COVID, as we see, are actually far-reaching and don't just have to do with nutrition, but actually help the whole family, help all to be healthier, inshallah. With that, I want to emphasize that you guys are being very shy. I don't see many questions coming in, and our session is about sharing and asking questions and learning more from each other. So please don't hesitate to put your questions in the Q&A box. Thank you again to Concern for your presentation on your experiences in Somalia. And now I would like to invite Lorna Muhiwe to join us from Save the Children Uganda to tell us about the adaptations they've made to mother and baby areas in Uganda. Lorna?
Thank you, Andy.
Thank you.
Andy. Yes, I'll be talking about IYCF adaptations in mother-baby areas of Uganda. Good afternoon, everyone. Once again, I'm Lona Muhirwe. So this particular case study is drawn from one of our projects in Uganda. It's funded by ECHO, and we implement it in 1 refugee settlement and 2 transit centers. The project duration specifically for this discussion is from May 2020, but key to note that we had a year of implementation prior to this, and this was the second phase. We are targeting 80,000 beneficiaries, both refugee and host community members in that particular settlement, Chaka 2, as well as another one, Changwali, Matanda, and Nyakabandi transit centers. Next slide, please. So the IYCF component of this project is Result 3, and as I've already said, we are focusing on provision of gender responsive and age appropriate IYCF services, targeting pregnant and lactating women and children under 2. On the right side of the slide is really you see a map of Western Uganda where the locations are, with 2 transit centers, which are basically holding centers for refugees before, as the arrow indicates, they are relocated to a refugee settlement. And so we work in those 3 locations. Next slide, please. So what are the mother-baby areas? The mother-baby areas for our IYCFE programming in Uganda offer a safe space for provision of information counseling, breastfeeding advice, nutrition screening, and other support. In this particular project, we are supporting 6 mother-baby areas, and we target pregnant, lactating women and children under 2 over the 1,000-day window. And key to note is our strategy has been to co-locate these mother-baby areas, either with a health facility or in a child-friendly space where we are also doing ECD, or in a transit center. Last year, we reached approximately 8,600 female caregivers and approximately 9,000 children. In these mother-baby areas, we are also aiming to strengthen the link between nutrition, sexual gender-based violence, family planning services, and immunization through integrating this information and also through referrals to enhance protection of women and children. Next slide, please. So this slide is basically showing what a mother-baby area really looked like pre-COVID. You can see the picture on the left-hand side of the slide. It could be pretty crowded. We have huge numbers. We have a nutrition volunteer conducting a food demonstration. Next slide, please. So what happened in 2020 was that the situation really changed due to the COVID outbreak. And currently for Uganda, we have approximately 1,200 confirmed cases. These are just Ugandan cases. Another 1,800 approximately non-Ugandan nationals. 60% of our cases are imported, but we have increasing local transmission, and we've carried out approximately 284,000 tests to date. So what have been the adaptations? Next slide, please. And as the previous speaker did, I will also be talking about what the disruption was due to the COVID outbreak and what interventions were affected in our programming specifically. Now, as early as March 2020, the government instituted a very strict lockdown with mobility restrictions. No public private transportation was allowed, and this disrupted the movement of pregnant and lactating women, caregivers, and volunteers, particularly those who had been attending the mother-baby areas that were co-located with health facilities. Utilization of these services dropped, of the health services, as well as the services at the MBAs. There was also a closure of schools, and we were forced to close our mother-baby areas at the child-friendly spaces. And then the transit areas were also closed because the government closed the borders, and we had 2 MBAs closed in this location. This affected our intervention, our entire intervention, which was really to ensure that we delivered integrated IYCFE and sexual and gender-based violence sessions in these mother-baby areas, providing information, counseling, and referrals. The other disruption was that the Ministry of Health suspended mass nutrition screening countrywide in March. And through this program, we were conducting a mass nutrition screening at least quarterly. And this intervention was also affected. The other disruption was related to the ban on social gatherings involving more than 10 people. This meant we were unable to conduct community dialogues to influence IYCF practices at household level. We could not conduct the food and demonstration, garden demonstrations, and we were unable to support our lead mothers. These are sort of peer mothers leading support groups to conduct nutrition and SGBV education sessions in communities. And finally, the Ministry of Health issued a no-touch policy directive for community volunteers, and this made it extremely difficult to support home visits for active case identification. Next slide, please. So in terms of the adaptations, we had to think about what was it that we could do to continue providing these services. And when we look at just provision of the IYCF areas, in the mother baby areas, in the static area, MBAs, the objective of our adaptations was to ensure safe reopening or continuity of MBAs for IYCF e-service provision. And this was supposed to come into place around May as restrictions were slowly eased. But of course, the government had now issued new SOPs, and the gatherings, big gatherings, were no longer acceptable. So what we have done is we have now split the mother-baby pairs into groups of 15. We've allocated them a separate group, and now we allocate them a specific day and time in the week to attend the MBS sessions. It's no longer just a walk-in the way it used to be. At all entrances of the MBS, we have put hand washing stations, and mothers are required to wash their hands, caregivers are required to wash their hands before entry. We are also conducting temperature monitoring on entry. And this is working very well, especially where we have an MBA co-located with a health facility. And then we are trying to make sure that we roll this out to the other locations that are not co-located with health facilities. During sessions, we're enforcing social distancing. We're also encouraging counseling to be done outside, for example, where ventilation is better. And we are encouraging mothers to use face coverings during sessions. Next slide, please. So this is just showing a volunteer conducting a session outside with a mother, and then an attempt to achieve social distancing with even some mothers standing outside as they listen to information from a nutrition counselor. Next slide, please. So again, when it came to providing these services in mother-baby areas, our objective was also to ensure safe continuity of IYCF sessions, but in the context of COVID-19. And really in line with the first presentation that we had to adapt to retrain our nutrition counselors and volunteers on what kind of messages they needed to communicate on IYCF, but in the COVID-19 context. We have had to print and adapt additional essential messages related to breastfeeding and complementary feeding in this context. And now we are integrating our existing IYCF materials and IYCF counseling cards with information on COVID-19. Next slide, please. So we do have already some resources, for example, from the government, developed with other partners. We have information that health workers and counselors, nutrition counselors can provide. And also in our own booklets and job aids that we have developed for our counselors, we are ensuring that there is information on how mothers, caregivers can maintain infant and young child feeding practices in this context. Next slide, please. Yes, and for especially as we work with health workers and they support us in counseling mothers, we are really focusing on 4 key recommendations that the Ministry of Health has come up with. Of course, these are adapted from UNICEF, WHO, and these 4 key recommendations are now providing us with guidance as we reprint our counseling cards to include these key recommendations. Next slide, please. So the other challenge that we have had in this context is how best to provide information on IYCF practices in the context of COVID. Since there was a lot of restrictions on movement and decreased attendance, and even getting back to the prior levels of attendance has been difficult. So our objective became, in terms of adaptation, our objective was to intensify the integration of messages on COVID-19, but to start using innovative communication channels as part of IYCF service delivery, channels that we previously had not been using because we focused on either the mother-baby area or a community dialogue to communicate to our beneficiaries. So some of the things that we have then done are we've trained media and journalists on IYCF in COVID context. They're able to integrate some of these messages in their communication with the public. We are conducting radio talk shows and radio spot messages. We'll be running this on 3 radio stations. We have been running this for the past 3 months. We have provided panelists with talking guides, and our panelists include health workers and also technical staff from the districts. And we have made sure that we translate all these languages into these messages into the local dialects, as there are many, because we have both the host community and the refugee community, and these translations have been achieved. So on the right-hand side of the slide, the lady in a red jacket is one of our nutrition officers sitting with a district health officer and a journalist in a studio, basically conducting a radio talk show on how caregivers, families must ensure that IYCF practices, recommended practices, continue in this context. Next slide, please. And then when it came to monitoring the status, the nutrition status of vulnerable groups, we are unable to do the mass nutrition screening, and then also active case identification is difficult because of the no-touch policy. So we have had to find adaptations that ensure continuity of nutrition screening. And what we did was, with the agreement of the local authorities, we have been able to intensify house-to-house visits by nutrition volunteers to provide mock screening and IYCF counseling. But then one of the conditions for us to be able to do this was that we had to procure IPC kits, infection prevention and control kits, for our volunteers, which included masks, gloves, and hand sanitizers. And we also have had our nutrition volunteers training lead mothers on MWAC and distributing MWAC tips in the community so that this screening can continue right at household level. And we can see our 2 nutrition volunteers with Save the Children carrying out screening on a child as the father of the child watches. Next slide, please. So what are the initial learnings? We started in May, actually late May, and one thing that we have realized and reflected on is the cost of adaptations. Adaptations cost money. We needed additional resources to retrain our nutrition officers and volunteers, to cascade trainings for Mother MWAC, and also for procurement of infection and prevention materials for our volunteers, as well as conducting media-mediated messaging. The other reflection that we've had is the need for collaboration with local authorities. Even today, we need to obtain approval for trainings, for home visits. When it comes to reopening of MBAs, we've had to get approval from local authorities. We've had to sit with them, work closely with them to agree on what will be the SOPs, what kind of monitoring will they be doing, and how shall we ensure compliance to some of the preconditions that they have given us. So that has been critical to minimize further disruption. And the last learning from us is the high level of adaptability needed due to the fluidity of the situation. For example, the transit centers that were closed now host quarantine units for an increasing number of asylum seekers who are entering the country through porous border points. And this is leading to a previously unanticipated need for services, as we have pregnant and lactating women and children under 2 in these quarantine units, and yet our MBA is closed, and we need to be thinking, how do we safely reopen this and start providing services to these asylum seekers who are now in quarantine at the transit centers. Next slide. Thank you for your attention. That's it from Uganda. Over.
Thank you so much, Lorna. I think you've shared a great experience from Save the Children in Uganda. For me, it's really interesting to see, in particular, the pictures that you're sharing, to see how in practice people are making it adaptations on the ground. It's also interesting that we need that one of the things you highlighted about the inputs that are required. Definitely, there's a cost factor in terms of both finances for PPE, etc., as well as for time, because we have smaller groups. We need to do more sessions. It's great to see. Thank you so much. Not great to see the additional financial requirements and time requirements, but that if we acknowledge them, at least we can handle them. And I think most of the donors are trying to help us adapt as well. So thank you so much for that, Lorna. And now I'm going to hand over to Alex to go to the quiz. Over to Alex.
Thanks, Andy. And thanks, everybody. So I would like to encourage all the participants, while we prepare for the Q&A, to hopefully you have a phone, or you can use your laptop or desktop, to please connect to the link shown up, the www.menti.com. And when requested, please enter the code, the 8740141, sorry. So that we see how much, and I'm sure you all paid a lot of attention to the presentation. So please try to join this very fast, very quick exercise. Again, linking to www.menti.com, and when requested, enter the code 874041. I'll give you another couple of minutes for everyone to connect. And it's just, again, a quick and fun way to make sure we all understood what our colleagues from UNICEF, USAID, Concern Worldwide, and Save the Children have shared with us. Again, I'll give you just a few more minutes to connect, and maybe it's time we start. I hope, again, you can see the link where you need to connect. It's menti.com, www.menti.com, and use 874041. So we are starting the game, and I hope you will all enjoy it. So the faster, the one with more points. So the question is, the counseling cards for IYCF in the context of COVID-19 are only for mothers that are suspected or confirmed with COVID-19. Yes, it's true. No, it's not true. I don't know. Please answer. Okay, well, the counseling cards that were presented were actually meant for women, for mothers, to be used for mothers that are actually suspected. Yes, so the answer is yes. And so these are the additional 10 cards that Peggy presented. But let's move to the next question. Sorry, I'm having problems scrolling. So the IYCF messages on the counseling cards can also be adapted for social media and other media channels. Yes, true, no, not true, we don't know. Absolutely, well done. And again, let's move to the next question. In Uganda and Somalia, they did not adapt to COVID-19, so IYCF programs are closed at this time. Yes, they are closed. No, they are up and running. We don't know. Absolutely. Thanks again, everyone. So again, the additional counseling package that Peggy and Ashima presented is meant to be used for women that are confirmed or suspected in line with WHO UNICEF recommendation, okay? The generic counseling card can still be used for any other mother, okay? Thanks again, and I give back the floor to Andy for the continuation.
Thank you, Alex, for guiding us through the quiz. A little bit of technical difficulties, but it still was interesting and fun, and I think a new experience for all, or many, let's say. Okay, I'm going to hand over the floor now to Deborah to lead us and facilitate us through the questions and answer session. I know that we've had more questions coming in, but do please continue to write in your questions while we go, while we have this session. Thanks. Over to you, Deborah.
Yeah, hi everyone. Wow, wonderful presentations, really excellent. Please note that the presentation with links, including the USAID image bank, will be available on the Tech RRT website. Most of the questions have come in for concern Somalia. One of the questions was, is the fear of contracting COVID-19 a misconception, or is it an actual real concern of the disease within the health facilities still? Knowing that you are making these adaptations, do you think, it's still a real concern rather than a misconception? Emmanuel.
Thank you, Deborah. I didn't get the question clearly. Did you mean the fear and myths and misconceptions?
Yes, the fear of contracting COVID was stated as being a misconception. Just wondering, is this still a real concern within health facilities of disease transmission within the health facilities? Although obviously adaptations are being made.
Yeah, thank you, Deborah. Yes, the fear, myths and misconception was really a major factor. In fact, at the onset of COVID, just when we had the first outbreak, you'll see that most facilities in Somalia recorded a slow attendance, especially for OPD consultations. And this might have been linked closely with this. But now with these adaptations, especially the extra triage areas well set up, and then hand washing facilities, both at the entry and exit, boosts some confidence to beneficiaries to be able to access services, and as well as the correct messaging. And most partners now in Somalia, and in our case, we see the trend for health service utilization picking up again. So this implies that these adaptations are working. Thank you, Deborah.
Fantastic, thank you, good answer. I'll address one more to you, Emmanuel, and then I'll go through to Uganda. Did you, in Somalia, did you conduct an assessment to identify the underlying causes of the reluctancy, people not wanting to practice hand washing behaviour? Has there been any assessment done of the underlying causes for this? Emmanuel.
Thank you, Deborah. Not for now in the context of COVID-19, but previously, Concern conducted CAP survey pre-COVID, and yes, the findings were related not only to the scarcity of water, but most people will wash hands, but not as clearly or as required, as demonstrated in one of the pictures that we shared. And so, as much as people are washing hands, you could say that communicable diseases like diarrhea were still on the rise. So with COVID-19 now, at least it's an enforcer whereby we found that most participants or beneficiaries are able to clearly adhere to the proper hand washing practices as per the required protocols. And then, as we mentioned, the results are seen. We see hygiene-related diseases and infections like diarrhea going down, despite that during the COVID-19, we're just in the cool season where there are a lot of floods, and we expect that the diarrhea cases will be on the rise. But then we see that that's not the case. So we can attribute this to proper hand washing practices, and when we conduct our planned CAP survey, then we might have more concrete information to us this, be able to attribute this. Thank you.
Okay, thank you, Emmanuel. Lorna, there was a question here. In fact, a couple of people have picked up as to people in the slides, in the Uganda slides, not wearing masks, and just wondering what the reason for this is. Would you be able to explain, Lorna, please?
Yes, yes, I thank you. Now, for Uganda, the government did issue a mandatory directive requiring people to wear masks in public places, and indeed has enacted a law to this effect. However, we see that compliance is very low, and for the Ugandan context, the system of governance is decentralized. So we have local governments at district level. And the challenge that we are having at this local level is really the enforcement of this directive. Enforcement is very weak. In some of our locations, we are trying to work with the district local governments to see if they can support enforcement of these directives, so that if, for example, a mother needs to enter an MBA, wearing of that mask is mandatory. As of now, it isn't. And so we continue to provide these services while encouraging community members to adhere to the guidelines. But like I said, enforcement is still quite weak at local level. Over.
Yeah, interesting. Thank you. Yes, several have been very perceptive in looking at those photos. Emmanuel, going back to Somalia, have there been any things we've seen the challenges, but have there been any things that actually worked better than before the COVID-19 adaptations because of the adaptation? In other words, have the adaptations actually had an added advantage benefit on the programming and etc.? For example, the smaller groups, did that mean that mothers could felt more free to ask questions and could answer more questions? Or perhaps, yeah, have you got any feedback that you can provide on that? Emmanuel.
Thank you, Debbie, again. Yes, I will say so. For example, the smaller the group, then you could see the interaction is very lively, and you could easily pick up the mood of the participant, and you could easily get to see the understanding. One of the great aspects is in terms of time management, because one of the reasons why some caregivers will not want to participate in those sessions is because of time. And now with these smaller sessions, they have also been adapted in a way that the duration is also minimized. So mothers are able to come, attend the session very short time, and be able to go back to attend to their chores. And the household visits as well, you're able to identify the real situations at the family and be able to address and discuss those real time. So I would say that even post-COVID, I think this is something that might still be considered. And as a member of the Somalia SAG and the IYCF programming, we will be sharing these learnings to the larger group to see how if this could be adapted in the context of Somalia and piloted a little bit and eventually adapted if it seems to be working. Thank you.
Oh, great. Brilliant, Emmanuel. What about Lorna? Have there been any things that have worked better than before COVID-19 because of the adaptations? Are you able to explain for Uganda?
Yes, as is the case, I would say with Somalia, we are seeing that the small group approach, where we have grouped these mothers attending the MBAs into smaller groups, is really working. They feel, you sense that there is more confidence in terms of mothers asking questions, for example, and even feeling that they have access to the counselor. So that is really working for us. And also, we also see that the hand washing, I think there is an increased appreciation of the need for hand washing, and we see mothers and caregivers trying to sort of replicate this practice at household level. So that has really been one of the things we've noticed.
Fantastic. Thank you, Lorna. Racing through these questions, what about, this is a really interesting one, especially since some of my work is persons with disabilities. How have you ensured that the IYCF COVID messaging has trickled down to beneficiaries? Most of the materials that have been shown today are printed versions, which can present challenges for some community members. And it's, you know, quite one-on-one. What other channels have you used to reach the beneficiaries? First of all, Emmanuel.
Debbie, thank you. Yes, that's a very, really great question. We have employed various aspects, not only printed materials. We have a pilot program learning on from the Cash for Improved Nutrition study in Somalia, where we used mHealth BCC approach. And these messages and scripts are transmitted through phone for the registered beneficiaries. And this is really an aspect that could be used to reach especially the disabled, who might not be able to move, but they can be able to see and they can be able to hear. This is a very great approach. There is an active RCCE working group in Somalia, which Concerned Worldwide is a member, and also a community engagement and expert pool, where Concerned is part of the team as well. And digital platforms are also being encouraged. And as I shared for the community engagement part, this involves household visits. So such beneficiaries will be targeted. They will be visited in their homes and ensure that this messaging is reached to them. We are also partnering with the Cash Consortium Working Group to identify some of these vulnerable groups that could be associated also for support in this, because as we know, these COVID-19 adaptations comes with cost aspects as well. We're talking about PPEs that complicates already the situation, as we mentioned, about 1 million children being projected for malnutrition. So you can imagine with these additional expenses, then with greater collaboration, they can also be able to access some of those aspects that can enhance an inclusive approach. Thank you.
Fantastic. Thank you. I've just got one very quick, and I just need a final question with a quick, sort of as quickly as possible, the answer. For Lorna, given that rumours and misinformation related to COVID-19 were highlighted, in fact, in both presentations, were there any structured or formal systems set up to track and address the rumours? Are you able to just provide a brief answer to that, Lorna?
Yes, Deborah, there are already systems in place, particularly in the refugee settlements, not necessarily led by Save the Children, but these are initiatives of other partners, including UNHCR. And what we do is through our meal component, we support a provision of information into this formal tracking system.
Fantastic. Thank you. Really wonderfully answered questions and good questions asked. Thank you. I'll hand that over to you, Andy.
Excuse me. Great. Thank you for that, Deborah, and to everyone who's answered questions and asked questions. That's super. I hope that we've got to answer all of them, but if we haven't, we will be sure to share with you after the questions and the answers when we share the slides and the webinar recording link. With that, I would like to go on to the next slide, please. As we start to wrap up, people, we need to share with people how you can request support if you need it. There are various different types of support that can be needed. It could be remote or in-country technical support. You could want some recommendations to be able to hire a consultant, or you could just want to ask a quick question, some of which you've probably been able to ask today, others maybe you haven't, and we're on different topics. But all of these things you can direct through the GTAM. There are various different providers of support who can answer your different needs, but all of it is being handled under the Global Technical Assistance Mechanism for Nutrition. So if you reach out to the GTAM on the link that's provided there, you will see a button that says request support, and you can put in your question or request in there, and it will be handled in a quickly and efficiently and in a systematic and coordinated manner. So please do have a look on the GTAM website if you haven't already to see what different types of technical assistance are available. With that, can we go on to the next slide, please? Great. And as we wrap up, this is my last slide, although I do want to say a big thank you. But before I do that, I do want to explain a little bit. We've got the webinar evaluation. It will take you about 5 minutes to do. There's one part which is our typical, which just gives feedback on how we did on the webinar today, any things that need to improve, or any possible ideas you have on things that you would like to hear about. But today there's an added component because we need to collect some information from you, but I'm going to hand over quickly to Alex to tell you a little bit about that. Alex, can you tell us a little bit more?
Yes, thanks, Andy, and thanks for those that are still holding on. It's really a prayer. One is, as Andy said, please help us improve, no? That's why there is an evaluation when we will provide suggestion. But in the same evaluation link, we are also asking very few questions on how have you been using the tools that Ashima and Peggy shared, no? So if you were familiar with it, if you have been using them, and also if you have ideas on what else agencies like UNICEF and USAID, TechRRT, the IFE Core Group, what are the other form of supports, no? And other form of tools that needs to be work together so that we can share with the country. So we are really asking your help in ensuring that, one, yes, provide us with suggestions on how we can improve the webinars and the cafe in particular, but two, tell us how those tools that have been created are actually being used and disseminated at the country, and eventually, if there is a need for additional tools, no, that you feel there are gaps that needs to be addressed. Please take your 5 minutes now to do that, as Andy also recommended. Back to you, Andy. And thanks, everybody.
Thank you, Alex, for that, for explaining that in a bit more detail, and I hope we get a large number of people responding. With that, we are 2 minutes beyond the time that we expected, so I appreciate you hanging in there. Thank you all. First, I want to thank all of the organizations that have been supporting this Learning and Sharing Cafe. We look forward to bringing you another one or more in October. Today, special thanks to Save the Children Uganda, to Concern Somalia, to WFP, to USAID Advancing Nutrition and UNICEF, as well as the IFE Core Group and Save the Children for really making these learning and sharing cafes a possibility. And a big thank you to all of you, the participants who are actually on the front line and making a difference to all the people in the world who are experiencing difficulties with infant and young child feeding. With that, I wish you all a good day, a good evening, a good morning, depending where you are, and look forward to seeing you next time. We will share everything within the coming week, so look out for that in your emails. Thank you.